Hello, my name is Alex Flores. I'm a physical therapist assistant student at Concord College, and I'm going to be talking about high ankle sprains or lateral ankle sprains. It's a real common injury that happens in sports or in everyday life. And just before I start, I want to ask, does anybody have any questions about what an ankle sprain is? Okay, what's an ankle sprain?
It's when when you're running, maybe when you drop it can break.
Okay. That's like maybe a stress fracture, or it can be a breaking the bone is like a stress fracture where you make an actual, like maybe a little bit of fracture, like a cut in the bone, or a compound fracture where the bone comes out of the skin. But actual ankle sprains are joint injuries. So it's gonna be like your wrist is a joint, that can be a sprain. You can sprain your wrist or your ankles are your most important joints. Okay, so I'm gonna talk about, it's gonna be just some things we can go over is the RICE method. And it's going to be what you're going to do right before the injury happens, right after the injury happens, and then some exercises for mobility. Okay, so Ivy, can you come over here and help me out? Okay. Thank you. Go ahead and take a seat right here. Okay. And before we start, is it okay if I work with you today on the ankle sprain? Okay. All right, so on RICE, the first one is rest. So as soon as you hurt your ankle, you want to rest it as much as possible and not walk on it. And then you're going to ice, you're going to compress it, and you're going to elevate it. So what we're going to do is, if you just had that ankle sprain, you want to stay off of it, and then we're going to try and elevate it. So if you just want to lie, just go ahead and turn your legs here over here for me. You can lie supine, which is on your back. So that's perfect. You can stay like that again. And we're going to put your feet up. Right here, you can use anything you have in your house, like a pillow that we're going to use here. Put it up right here. So the reason you want to elevate it is because it's going to keep all the blood flow going from the ankle coming back to your body, because that's what's going to cause all the blood flow that gets stuck here. Since gravity's going to take it down, it's going to cause a lot of swelling that's going to stop it from healing. So once you elevate it, and you want to do this as much as possible while you're watching TV or while you're sleeping at night, just to keep that blood flow, and you want to ice it. So you can use anything, like I have it in 2 Ziploc bags so it's not as cold on the skin, and you would leave it on the ankle that's injured. And when you ice it, you want to do the ice for at least anywhere from 10 to 20 minutes. So anything less than 20 minutes won't be as effective, and anything more than 20 minutes you can cause, depending on how cold the ice is, it can cause some tissue damage. So you just want to just kind of go back and forth doing that, resting in between, and doing 10 to 20 minutes. Okay? So then once you have the ice, the last thing is compression. So if you have a bandage with you, you can do like an ACE bandage. What you would do is you would start at the toes, right under the toes, and you would go tight. You would wrap it real tight all the way around the ankle, all the way to the top, right here, the high ankle. And you would go from tight to loose, right up here. So you just want to make sure it's tight enough where it's keeping pressure on it, but not tight enough where it's causing discomfort or any bruising or loss of like tingling or loss of feeling on your toes. That's too tight. Okay? So now that we have the RICE method down, we're going to go ahead and do some exercises for range of motion and mobility. So you can go ahead and turn over. Okay, so the first one is want to go ahead and you can sit in a chair just like that. That's fine. And then we're going to do the dorsiflexion, which is you're going to go ahead and just sit up and just sit a little closer. That way your feet are on the ground. Okay, you can touch the ground there. Perfect. Okay, so you're just going to go ahead and with the dorsiflexion, you're going to go ahead and it's going to be kind of like a calf raise. So you're just going to go ahead and push, pump it like if you're going to, there you go, perfect. So you just do that dorsiflexion there with your ankle, and that's going to help with the blood flow as well. You do about 20 of those. Perfect. Okay, so once you do those, the other opposite movement you're going to do is going to be a plantar flexion. The dorsal is going to be in your back by your heel. Then you have the plantar flexion, where you're going to go ahead and sit back a little. Perfect, like that. Just sit back where your feet are kind of not touching the ground, and kind of just move your feet. You need to keep this foot forward just like that. And then you're going to go ahead and just rotate it just wherever it's comfortable. The plantar flexion, just kind of, there you go. Kind of like if you're driving a car and you're pushing the gas pedal, you're going up and down. And that's the plantar flexion. Yeah, keep on, you want to do about like 20 of those. Just however it's comfortable for you. This last one we're going to do is going to be, it might be difficult depending on how the severity of it and how long you've had the injury. But just go ahead and sit back a little bit more on the table. Okay. And on this exercise, it's going to be, you're going to do the alphabet to help on range of motion and all of the ankle. So when you do the alphabet, we're gonna start with capital letters and you'll go from A to Z. You wanna make sure your foot is straight and you're not gonna use, what you don't wanna do is you don't wanna do the alphabet using your legs. That's working all your leg. What you wanna do is just work just your ankle. So you do the A in capital and we'll do a B, you go all the way to Z. And once you do that, you can do it about 3 times a day, whenever you have some free time. And if you feel comfortable with it, or if it gets too easy, you can also get a TheraBand or some sort of band, and you can put it around your ankle, around your foot, and you can use it as resistance while you're doing it. And then if you feel like doing some more, you can also do it with regular letters, lowercase. Try it with lowercase. So we do a small A, and a small B, a C, and you go through the alphabet just like that on the injured ankle. Okay, that's good. Okay, Ivan. That's it. Okay, so that's pretty much all the treatment for rice, the rice method for when you have the injury, and then also how to help strengthen it and lower inflammation on the injury. Does anybody have any questions? Okay, what's that, Ivan?
How about if you seek a lot of attention when it's broken? Like if you break it outside of your house, but you need a medical attention.
Like what do you do?
Yeah.
Okay, well, if it's actual break, then the problem with that is you want to get medical attention like at a hospital. So you want to call 911 because what's going to happen is that your ankle, the bone's going to come out. The bone's going to come out of your actual, wherever it is. So it can come out of your leg, like it can come out of here. Once that bone comes out, then it's going to cause a lot of infection. And the infection is going to be from the outside to the inside of the body and the bone. So then that's going to cause a lot of problems, and so you want to go to the hospital so they can treat that. And then once you go home, they can set you with antibiotics or anything you need afterward. What's that?
Is there any products that you can use?
Not for the infection. If it's a broken bone like that, you want to go to the hospital. You want to get it treated in the hospital, and if they do need to give you anything, they'll prescribe it to your pharmacy. Okay, so thanks guys. I just want to go ahead and if you guys have any, hopefully it's helped you. If you have a family member or you experience this problem, then you can help with the treatment and help it so you can recover faster. Thank you.
Thank you. Ah!